Hello, good evening, everyone. This is Shanieri Eze of Eze Health Center. Thank you for joining us tonight for our discussion on the COVID-19 and protecting your family as we are in back to school season. I'm joined tonight by Dr. Richard Cook. Many of you may recognize him from his weekly updates on COVID-19. Things are changing from day to day, week to week, and we're very thankful that he's been very active in keeping us very updated here in the Charles County area. So, for those who aren't familiar, Dr. Cook is an internal medicine physician in private practice who works and lives in Charles County and has been practicing medicine for approximately 20 years. He is also president of the Charles County Medical Society, official team physician for the Southern Maryland Blue Crabs professional baseball team, and loves to volunteer his time educating his community about various topics. So, welcome tonight, Dr. Cook.
Thank you very much for having me. My pleasure.
Absolutely. So, things have been very precarious over the past few weeks. I mean, we've been dealing with this pandemic with COVID-19 now for over a year. If you think about it, we're actually going into the third school year of being in a pandemic and impacting, students and families all over the country. And I think it's really important that we address the changing dynamics of the pandemic now that we have the Delta variant out there. So I definitely want to open up the discussion with first mentioning a few statistics that are affecting our local Charles County area. And these are the most recent statistics I'm sorry, let me say, as of the 17th of this month, August 17th. And the source is the Charles County Health Department. Since the onset of the pandemic, Charles County has had 11,767 positive COVID cases. The breakdown of that by age, about 14% have been below the age of 18, 75% between ages 18 and 64, and about 10% 65 and older. Just in the summer months of June, July, and August, we've had a total of 853 cases. 16% of those cases have been of vaccinated individuals, and 84% are unvaccinated. So a large majority of the individuals that we are seeing that are have positive cases and even hospitalized are primarily the unvaccinated. We are in changing times. We now have a vaccine options to help people, prevent people from getting advanced disease from COVID-19. There's still a lot of uncertainty out there, unfortunately, a lot of misinformation. And it's so important that we have a good understanding of how vaccines work, what it does, what's the truth behind it. So, if you can kind of explain, Dr. Cook, to us, how does the vaccine work?
Absolutely. Thank you for that question. And I think it's a good idea to preface that answer with a little virology. So, as we know and have learned, viruses infect our cells by essentially hijacking our cells to make more copies of itself. In fact, some of these studies show that once you are infected and hijacked with these viruses, the human body can make up to a billion and up to a trillion viral copies in just one individual. The problem is that this process in producing a billion trillion copies of itself isn't actually very accurate at all, and hence there will be mistakes all the time, and these mistakes can produce variants. Now, variants are very rare. What we're normally producing as far as variants are duds. And let me say variants of concern are very rare, but variants are very common and they're mostly duds. And that means that they don't and won't infect anything or just won't infect anything as well. But every now and then, when you get these billions and trillions of copies multiplied by hundreds of millions of infected individuals worldwide, you might get a copy that binds or infects better. These variants are not common at all. These variants are concern, are not common at all. And you've already heard of some of them. We've heard of the UK variant, the South African variant, the Brazilian variant, the Russian variant, and of course, this Delta variant first detected way back in 2020 December in India. And the first case actually showed up in March 2021 in the US. Now, as I mentioned, there's many variants that are produced. They're mostly all duds, and every blue moon we get these variants of concern. And a variant of concern is just a virus that is not only more contagious, but it also infects better. The Delta virus is no doubt one of these, and it is more contagious than the original virus, which had an infection rate or an R naught, as we call it, of around 2.5. And the Delta variant has an infection rate of around 3 to 7, which is similar to chickenpox. So that brings us into the second part of the question. How do these vaccines work against the variants? And that requires just a little bit of um, virology and vaccine history as well. We have three authorized vaccines in the country: Moderna, Pfizer, they're messenger RNA vaccines. Then we have the J&J vaccines, vaccine, and that is a single dose as opposed to the two-dose messenger RNA vaccines. And so, first, we'll talk about whether or not a vaccine is able to prevent a person from being infected. And again, this is with the Delta, and
Mhm.
therefore prevent the same person from spreading the infection to someone else. And then the other endpoint we'll discuss is preventing serious complications like hospitalizations, ICU admissions, and death, which is really the biggest endpoint that we're concerned of. So let's start with the Pfizer vaccine and talk about how well it prevents infection. Now, studies on the Pfizer vaccine tell us that after a first dose, it's a two-dose vaccine, and at least 2 weeks after that first dose, which is when your antibodies are starting to show up and be potent, you get about a 64 to 88% after the second dose at preventing symptomatic infections, depending on what study you read. This means there are a lot of people uh, outside of that percentage that are going to fall on the other end and be able to uh, have a symptomatic infection. Symptomatic infection means runny nose, fever,
The
body
calm.
aches,
Yep.
etc. Exactly.
Mhm.
And now let's talk about hospitalizations with the same vaccine, Pfizer. These same studies showed a 78% after the first dose. We're still talking about the first dose of about 93 to 96% reduction um, after the, excuse me, they showed a 78% reduction after the first dose and then a 93 to 96% reduction after the second dose of Pfizer at preventing hospitalizations, ICU admissions, and deaths. So you pretty much um, would be a rare patient to end up in the hospital sick after you got the second dose of Pfizer. Pfizer
Mhm.
was the first vaccine to come out, therefore, we have a lot more information on it. So
Right.
let's now talk about the Moderna vaccine. Moderna vaccine came out second, not as many studies about it, which, as you know, the Moderna is also a two-shot messenger RNA vaccine, but they showed that there was a 72% reduction after the first dose, just one dose,
Mhm.
and a 96% reduction in preventing hospitalizations, ICU admissions, and death against the Delta variant. They weren't really looking at symptoms with these studies. So, again, they're very good at keeping you from dying. So now we'll talk about the one shot or one dose J&J vaccine, which is an adeno DNA virus vector. And despite this vaccine having been out last and being less studied, we do actually have some surrogate studies, and these studies were done about 6 months ago or so. And at the time, they were actually done against the worst variant at the time, which is the South African variant. And remember, the Pfizer and Moderna vaccines were done with the native variant, so it wasn't as potent, wasn't as infectious. And when they tested our antibody response to the Delta variant in comparison to the South African variant, it showed a very good antibody response. And you may recall from some of the earlier discussions that I had, if you ever saw them, that the J&J vaccine gets better with age. And at day number 49, there were about 100% effectiveness in preventing hospitalizations, ICU admissions, and death. So, what does this information mean? It basically means this: 99% approximately of everyone that gets admitted to the hospital, goes to the ICU, or dies is unvaccinated. So these vaccines do pretty well with those endpoints.
So there's absolutely value in getting vaccinated. And I think it's important for individuals to understand that the vaccines basically drastically reduce the chances of you getting advanced disease with the SARS-CoV-2 infection,
Right.
aka coronavirus. So understanding that fact, I think there has been a lot of kind of misunderstanding of how vaccines work, what these vaccines do exactly. But it's just important that the end point that we're looking at is severe disease, hospitalization, and death in particular. And
Right.
it's been proven now for some time that the vaccines have consistently been effective towards this. Um, no, so that's kind of the obvious benefit of getting the vaccine, is reducing these chances of hospitalization.
Right.
Now that the vaccines have opened up to allow younger children to get vaccinated, can you tell us a little bit about that? What are the guidelines and regulations on childhood vaccination for COVID-19?
So I have a daughter. She's 10 years old. She's not eligible. But if you're 12 to 17, you are eligible for the Pfizer vaccine,
Hmm.
which is safe, uh, EUA approved, and 18 is the Moderna vaccine, and
Right.
they're very safe. I talk to patients all the time about the safety of them, and I'm an internist, so I only see adult patients, but I generally ask them if they've ever taken penicillin or Tylenol or another antibiotic, and I actually show them the statistics that the vaccine is safer than over-the-counter medications. So yeah, it's a very safe vaccine for everyone, including kids.
And that's good to know. There's been a lot of vaccine hesitancy out there. Unfortunately, a lot of misinformation
Hmm.
and flat out, non facts in regards to the vaccine. Many of them have been surrounding, the idea of the mRNA, if it's going to cause any type of disruption in your DNA. Another one is concerns about fertility.
Hmm.
Other ones, in regards to the speed at which the vaccines were released
Right.
to the public. What do you have to say in regards to a lot of these misconceptions and untruths about the COVID-19 vaccine?
Well, this is where science and common sense uh, comes in hand to hand. Early on, there were internet stories about a common protein, not a specifically shared protein between the placenta and the spike protein of the coronavirus. It's called syncytin 1. And the internet disinformation campaign was that since they're similar in their minds, that the body would attack the placenta protein and cause infertility. But
Wow.
I'm here to tell you that the two proteins share actually a very small amount of genetic material, but definitely not enough to make a match. An analogy would be like saying you and I share the same phone number just because both numbers contain the number 7. That's how different they are. I couldn't dial just one number to reach the other person even though we shared that one digit.
Right.
And that's the correlation between these two different proteins. And really when you consider how many people have already been infected around the world naturally and developed antibodies, if the infertility theory were true, you'd expect the body to make antibodies against unnatural infection as well. And then
Mm.
that would show up in fertility sticks or infertility statistics. And this hasn't been the case.
Right.
I think during the development in the studies of the vaccine, 23 women became pregnant during
Mm.
the vaccine studies. One of them lost their baby, and guess what? She received the placebo. She did not receive the vaccine. And then last but not least, they have done massive studies on the placenta of patients who've been infected and looked for the same thing on a microbiological level, and it has not been found at all. So that is what we say a myth, and it is untrue. And in real time, we seem that it hasn't been true either.
Right. So there have been studies to actually disprove that thought or belief that fertility is affected by the vaccine. So that has been systematically debunked.
Absolutely, absolutely.
Yes, and so I know the thought of getting the vaccine. It seems like the vaccination rates have started to increase now that the Delta variant is out there,
Mhm.
and that it is currently the most dominant strain of the coronavirus. It's found to be more contagious. It's found to have more severe outcomes and even faster onset of symptoms versus the original strain of the coronavirus.
Right.
So I think that's one thing that's important for a lot of people to understand is that what we understood about coronavirus initially with the pandemic uh, mostly holds true, but not all things, because we are dealing with basically a different mutation of this virus. So we do have to modify the approach to some degree. Masking is still very effective. They are finding. We now have a vaccine, which we did not have before. There are treatments now that are available that weren't available initially when excuse me, when at the onset of the pandemic. So understanding that as we learn more about this virus, as we learn more about how it mutates and how it's showing up, we have to modify accordingly. I know for a lot of people, the frustration of, uh, great, we have this vaccine, I'm vaccinated, and then being told that if you are vaccinated, you're almost in the clear. You're almost, you can go out in public without masks. When you're around other vaccinated people, you're relatively safe. But now we have a Delta variant, and it has changed the game. Studies have found now that the vaccinated and both unvaccinated and vaccinated people can carry the virus and actually transfer it to others. So these are things that initially we didn't think was going to be the case, but now we know, again, with this particular variant, that it's a problem. So I guess, kind of explain how can we adjust to these changes when we have these new recommendations by the CDC? What's our best way of determining, how we would go about, changing what we do from day to day, whether it's the masking and all of that, traveling and things of that nature.
Well, it all goes back to the basics. It's not rocket science. There's nothing new about it. Mitigation, vaccination, mitigation with testing, contract tracing, social distancing, masking, all those things, ventilation, filtration. But the number one mitigation factor would be vaccination.
Vaccinations, yeah.
Yeah, and it's that simple. It's not something that we don't know. If you look at other countries, I wrote down a couple statistics about some other countries around the world, and some people think that they're giving erroneous numbers, but um, even before they had a vaccine, these countries were doing well, and they're still doing well. And let
Hmm.
me give you some of that data. Singapore, uh, the whole pandemic has had 45 deaths. 45 deaths. Taiwan, the whole pandemic, 821 deaths. New Zealand, 26 total deaths.
Wow.
Finland, just over 1,000 deaths. Australia, that big old continent down there, 970 deaths.
Wow.
And of course, when you get to something like South Korea, you get to 2178, so 2,100. That's still vastly under what we are per capita when you
Per
talk about
capita, right?
cases per 100,000 patients. And again, most of that was before a vaccine uh, program was undertaken. And those countries aren't at herd immunity with vaccine status either. They just mitigate. And it's the age old homage that works over and over again. If you isolate a virus, it will not find a host to replicate in and it will die out.
Right, right. And I know a question just came up in the chat. Jamie asked, what are they doing differently? You mentioned mitigation. Was it the lockdowns? Are there higher percentage of vaccinations in these areas? Are they masking more? Um, what do you think is, or what has been proven to be the effective thing that all of these countries are doing to keep their rates so low?
Well, all the people that take mitigation seriously here and vaccination seriously here,
Hmm.
that's not too much of a question there.
I see.
And their government, and they're not socialized governments. All these governments have a higher democracy index than the US. They
Interesting.
they just know that without healthy people, there is no economy because there's no one to work. They
Right.
know without any healthy military, there's no one to defend their country. They understand that. They're not about freedoms, and my rights and so forth. They're getting together just like we did in World War II and the American Revolution and any other time when the community got together for the benefit of the whole. And so we have all these regional places in the states that have been unfortunately propagandized,
Mm,
and that's why we're in the situation we're in. I mean, we're like Brazil, we're like India, we're like Russia, and we're one of the top first world countries on the planet. But this
mm,
pandemic, if it was an attack on American soil with with another country, we would have handled it poorly. We would have failed. We would have
mm.
gotten F minus, and we're basically under attack right now. When you talk about 600,000 plus people that have been killed by COVID, what and how would we have reacted if this was a military assault on us? Listen,
Mm.
we had about over 3,000 people killed at the 9/11 terror, and we went to war with people. We developed NSA. Um, we came together,
Right.
as a community and fought that. And now we're talking about 600,000 people. So it's about uh, those countries coming together and us really not having any cohesiveness to do that.
Right, right. And that's a very good point. I think this idea of being individualistic and what I do and my rights, but what I do and my rights and what I decide to do is actually affecting other individuals. So, if you have one state that has, mask mandates or, really implementing policies that are backed by science, and then the neighboring state has just kind of open doors and no mandates. I mean, it's not as if they're mutually exclusive and not going to affect each other, right? So understanding that what's happening in one region of the country definitely does affect the other regions as well.
Yeah, and we could talk a long time on that,
Yeah.
but some of these things just don't make any sense when you talk about how people take prescription medications, which kill more people than the vaccines. When people who actually are unvaccinated, when they get to that hospital, they want everything. They're not scared of those medications and the doctors and the hospitals at that point in time. So there's
Right.
really a disconnect between critical thinking and common sense. But
Yeah.
I don't necessarily blame them because, unfortunately, when you start looking at something to back up your thought process, you're going to find it, and it's going to reinforce it, unfortunately.
Correct. Correct.
Yeah,
Yeah.
the vaccines have been some of the safest, if not one of the safest, medical pharmaceuticals that have ever come out in the history of medicine.
It's amazing. It really is a wonderful and amazing scientific feat that has been achieved in a relatively short period of time with the amount of resources that have gone towards it. And that is part of the reason why we were able to get a vaccine out so quickly.
Right.
I know we're now going into a new school year. There's, we were making progress this summer with, getting people vaccinated. There's areas that had low percentages of vaccinations, others that had higher percentages, but at least we were on our way of slowly kind of turning things around. And then the Delta variant hits us. The plans to open the schools has proceeded to where, especially now in the Charles County region, we are opening schools for in-person instruction. Virtual learning will not be as a available platform for a majority of the students this school year. According to the American Academy of Pediatrics, they are in fact encouraging that schools primarily be reopened. And in their statement, they state that schools and school-supported programs are fundamental to child and adolescent development and well-being, and provide our children and adolescents with academic instruction, social and emotional skills, safety, and opportunities for physical activity, among other benefits. Everything possible must be done to keep students in school in person. So that is a statement from the American Academy of Pediatrics. I understand that the Charles County school system has, in fact, come up with a reopening plan. It's actually very highly detailed, and it is available on the CCBOE website with all of the recommendations and regulations on how to safely reopen schools. We are dealing with we are in the middle of a pandemic still. It's gone through waves and surges, the ups and downs, but in fact, this is happening in real time. The transmission rates are going up. Charles County is considered a high transmission area. We now have a vaccine versus last school year where that wasn't, widely available. So taking that into consideration, and now wanting to, reopen schools, there are a lot of, parents that are apprehensive. So what are the best ways, of getting students and parents and families ready to enter this new school year. Um, you mentioned earlier about mitigation, masking, sanitation, and social distancing. So those things haven't changed, right? Those are things that we can still do. And of course, vaccination is the new tool in the toolbox that we can utilize for children that are eligible. But what can we as parents uh, do to really help our kids transition back into the school year?
Well, let me start out by saying this stuff is extremely well studied. And there are ways to properly open up schools in the middle of a pandemic. There are.
Mhm.
There are volumes of this information, and I think the problem is implementing all of it. Because if you did
Mhm.
it the right way, you would be fine. There's just no doubt about it. Um, but I think what we have to think about is um, when we have a risk reduction strategy, that's different than the goal of achieving zero cases, because
Mhm.
there's no such thing as zero risk in anything we
Right.
do, and of course, certainly not in a pandemic. But everyone realizes these are immense changes, and there is no perfect plan to reopen schools safely. Only really what we call less bad options. And with schools, there is no one size fits all that works for every school. Schools have limited budgets and staff. Compliance may be imperfect. Learning will be different. And yeah, there'll be disruptions in schools, and we may need to change course unexpectedly. I had one teacher. I actually saw one teacher and two vice principals this week in my office. And one of the things that the teacher said is, I was like, "What do you think about them opening up schools with limited homeschooling?" And she said, "I give it a month."
Oh,
So
geez. Yeah.
if you do these things right, it'll last more than a month. But um, again, there's a lot of data here, and I get my data from the Harvard School of Public Health Risk Reductions. And you've mentioned some, um, but I'd like to focus on healthy classrooms. Okay,
Mhm.
obviously you have to wear a mask. That's a given. We have some people out there that are anti-mask and don't think they work and inhibiting their rights. But all teachers, students, administrators, visitors wear face masks indoors. We have to train students and staff how to wear them properly. We have to ensure they meet the effectiveness criteria, the proper masks. Make short times throughout the day when students and staff potentially don't have to wear their mask, like eating. You got to wash your hands frequently. Wash your hands immediately before leaving home, leaving the classroom, eating, touching shared objects, touching one's face, and leaving school. Wash hands immediately after arriving to school, entering classroom, finishing lunch, touching shared objects, etc., etc. Use hand sanitizer, 60% ethanol, 90% isopropanol. Maximize physical distancing. 6 feet is great, but if you're masked, you can do 3 feet. Repurpose large unused spaces in school for temporary classrooms, meaning the auditorium and gyms. Move class outdoors. Replace hugs, handshakes, and high fives with smiles, waves, and thumb ups. Maximize group distance to slow transmission chains. And that's some, but the other thing is testing. Most places are using the PCR test, but the better test that a lot of experts recommend is the antigen test. The antigen tests are quick, they're cheap, they can be used over and over and over. And when you find that person with an antigen test as opposed to the PCR, they're already infectious, which means you can
Mhm.
give it to someone else. And at that point, you isolate them and contact trace and so forth. And that stuff works really well. It's just a lot, and I haven't seen any place do it that I've read about, including Charles County. So there are much more things about ventilation, filtration, HEPA filters, et cetera, that I'm going to. I did a video on this. It was about 15 minutes, and I ran through that really quickly. But if you have any additional questions about that, feel free. Or, Chinier, you can leave the Charles County um, mitigation booklet for everyone to read.
Absolutely. Yes, it's readily available and it's quite extensive. As I was reviewing it, they really do have a very detailed protocols from every aspect, from the universal precautions, social distancing, even health questionnaire and pre-screening. I know I have my two kids returning to school this year, and we have to do a fever-free, they call a fever-free app. I have to scan them every morning, and that gets submitted to the school before they're even allowed in the doors. So they have been very particular and specific and highly detailed in regards to how schools can safely reopen. One thing that I've always encouraged as well is, supporting, your natural immunity as well. So I'm giving my kids the vitamins, the vitamin C and vitamin D and everything every morning. They just started school. They go to a private school earlier, actually about 2 days ago. And, last year, even as they were doing the virtual, kind of in between virtual and, hybrid, I guess you would say, a couple of days in school, a couple of days out of school. They only had, and the school is very stringent. They only had one case where, for the entire school year. And it really comes down to how well the school implements these recommendations. I think that does make a difference. And that's why, because they did so well last year, I am comfortable having my kids return this year. Of course, we know, Dr. Cook, that there's going to be cases, right? We can't expect that it's going to be a zero case scenario, but we're going to do everything we can to protect our kids and take those mitigating precautions.
Yeah.
So yeah.
When you look at the southern states and see that they're not doing that, that's the opposite end of the spectrum. And so hopefully we'll be able to set some examples here of what the positive end of the spectrum will look like. So we'll see. But I must say also that in order to have all that still in place, you have to do several things, of which I'm going to say right now very, very briefly. You have to make sure in your community that, number one, and most importantly, whether or not people are vaccinated. Number two, the amount of people in your area that are vaccinated, how prevalent the Delta variant is in your community, in addition to all those mitigation factors. So we still need a lot more people to please vaccinate. It is safer than any over-the-counter medication or penicillin drug that is out.
Yeah, absolutely. I mean, vaccinations it is really the key to us getting through this pandemic, us getting through a hopefully semi-normal school year. Like I mentioned earlier in the webcast, we're going into year 3 of impacting, the a school year. I think March of last year is when we had the shutdown, and then the entire school year last, 2020 to 2021, and now into this next school year. The Delta variant has, and keeping in mind that we somewhat anticipated this. This is what viruses do. They mutate. Sometimes they get stronger and more contagious, and this is, everyone's getting a crash course on virology right now, on how this thing works. So it's very important that we take the proper precautions to protect ourselves, protect our families. The vaccinations are the key. If you have not, anyone in the audience who's kind of on the fence about whether to get the vaccination or not, I mean, really is something that has now been proven to be effective. I mean, if you look at the hospitalization rates, if you look at, the number of the vaccinated versus the unvaccinated who are passing away from this deadly virus, I mean, it's a very stark difference. I know, Dr. Cook, you mentioned earlier, just regionally in this area, Charles Regional Medical Center and MedStar St. Mary's, they have 0 ICU beds at this point. We are at that tipping point, even in this area.
Yeah, let me mention one last thing, and then I'll be quiet because I know we're running out of time. But
Yeah.
you said very eloquently that all viruses evolve over time and undergo changes as they replicate and spread. I think one of the things that we have to remember in order to not be reactive to numbers that we see in real time is to be proactive. And let me tell you why. Because that Delta variant has that higher R naught, which means it's just as almost infective as chickenpox. My question to someone out there is, and this talks about exponential growth, is would you rather have me give you $1 million for 30 days or give you a penny that doubles every day for 30 days? Now, most people that might not be in stats would say, give me that $1 million. But here's the caveat: at the end of 30 days, one penny is worth over $5 million, and that is what exponential growth is. You don't see a lot of increase in the first 14, 18 days, but by day 28, it's over $1.5 million, and of course, day 30, $5 million, and that's what happens with these variants of concern. You don't see the uptick until very late in the disease process, and that's why the mitigation and vaccination is so important, and also not reacting to numbers that you're seeing just right now. Those numbers are going to explode.
Yeah, and we are kind of at the cusp of it at this point. So I think it's just important that people make informed decisions. Whether you choose to get the vaccine, which I highly recommend, or not, make sure that your decision is based on facts and not
And
false
common sense.
and common sense. Yes. And not given to the fears and the things that are out there, and unfortunately, it's costing people's lives. You hear these stories about people who had refused the vaccine, uh, end up hospitalized, and they're pleading, to their doctors to give them the vaccine, and they're being told it's too late at this point, and
Shannon, one of my patients, probably yours, has been unvaccinated, who's been hospitalized. Every
yeah,
single one.
yeah, and it's unfortunate because it's preventable at this point.
Yep.
Early on in the pandemic, we didn't have that tool, and now we have that tool, and it's free. Like that's the part about it. Um, my family, I have extended family in Nigeria, and they aren't able to even get vaccines, even if they wanted it. And here we are in the U.S., where the vaccine is free, readily available. We can walk into a Walgreens or a Walmart and get one, and not bat an eye. And unfortunately, in other countries, they're begging for it. They want it,
Absolutely.
So yeah, we definitely need to count our blessings in that regard. That testing and all these resources are free.
Hmm.
So certainly, if there's any other questions from anyone out there, we are taking questions right now in the chat. You can go ahead and put your question into the chat box. I will go ahead and post some resources for any individuals who want to know more about where to go to get the vaccine, vaccine locators, especially for individuals who wish to have their children vaccinated before the start of the school year, or at least get initiated into starting their first dose before the school year. there are, locations available for that. Also, Maryland has a what they call the COVID link, which breaks down all the information in regards to COVID, any relevant information about the vaccines, testing, questions that you may have. Can all be answered. I mean, there's definitely a lot of resources out there. Dr. Cook, we were talking earlier how, there's tons of websites and resources, almost too many. But it's very important that you go with those that are scientifically backed and based, because just as much as there's great resources out there, there's really bad, information. So it's so important that we know how to differentiate between the two. So you can, I know that for some parents that are watching, for those,
Things, do you mind?
go ahead, sorry.
With what you just said, always make sure you contact your doctor also to verify what you've read. And would you mind if I just go over briefly the new recommendations for the immunocompromised and the
Yes,
new
yes,
recommendations for everyone to get the vaccine? Okay, so
absolutely.
as we know, last week the CDC uh, decided to uh, give a third dose vaccine to moderately to severely immunocompromised patients. And they have a list, and that list is general. There are some um, medical issues on the frills of that would actually um, be uh, in the category to get that vaccine. But things like active cancer treatment, if you have an organ transplant, bone marrow transplant, if you were born with an immunodeficiency, advanced or untreated HIV, taking steroids. I actually told a gentleman today who's on a what's called a TNF inhibitor, which decreases your immune system, that he can get the vaccine as well. And those
Yeah.
vaccines are supposed to be done 30 days after your last vaccine, or if 30 days was a long time ago, get it now. And then, of course, either the 12th or the 20th of September, everyone's going to be able to get the vaccine, and they'll have tiers, and they'll start with the higher risk patients. And those vaccines, from what I read, will be recommended 8 months after your last vaccine. So, just a quick update on that. Call your
Yes,
doctors, and they'll be able to guide you.
absolutely. Thank you for mentioning that. That's very important. Things are literally changing from day to day, because that literally was yesterday where they mentioned that starting towards the end of September, that the uh, third booster is going to be recommended for everyone. But right now, from what you stated, the immunocompromised are able to get that third dose.
Right.
Yep, yep. So that's very important. So again, I will put up some resources in the chat window for any individuals wanting to know more about where to get the vaccine. Also, I'm going to include the link for the Charles County reopening plan. Like I mentioned earlier, the reopening plan for schools. Like I mentioned earlier, I had a chance to review it. It's very thorough. It will answer a lot of questions that are out there, and hopefully more parents can have a chance to review it, because it really does give us an idea of the protocols and the efforts that are being made to reduce the transmission, especially amongst students in schools. So I will post that as well. Thank you so much, Dr. Cook. Did you have any last remarks or anything that you'd like to mention to our audience tonight?
Just take care of your community, whatever way you can. And I appreciate this opportunity to speak with everyone. Thank you for inviting me, and hope to do it again sometime soon.
Absolutely. Thank you so much tonight. Thank you so much for coming out tonight on such short notice. I definitely appreciate your time. For those in our audience, Dr. Cook is a treasure to us here in the Charles County community. He gives us weekly updates, so hopefully you'll be able to catch that on the many different forums that circulate here in Charles County on Facebook. It's just important that we get this valuable information, and I think it's good to get kind of a regional, more community-based understanding of what's going on too. So again, thank you for joining us tonight.
My pleasure.
All right. So good night, everybody. Thank you.
Take care.
Bye.